Hi, my name is Yuanhong Huang, and I'm a psychology intern at the Counseling Center for the 2020 to 2021 academic year. In this video, I'm going to talk about some stigmas and myths about mental health concerns and therapy. Check and see if any of them sound familiar. Hopefully, this video will help shatter some of those beliefs that have led to feelings of shame and experience of discrimination among individuals who experience mental health concerns. Mental health stigmas exist worldwide and negatively impact people with mental health concerns, their loved ones, and family members. They may feel ashamed and experience social isolation because of these stigmas. The fear of social rejection and disapproval can also discourage someone from seeking treatment for mental health conditions. However, most of these conditions do improve with treatment, especially early treatment. Many people hold the belief that having mental illnesses means a person is insane and crazy. They're unpredictable, dangerous, and may suddenly act violently towards others. In fact, the vast majority of people with mental health concerns are no more likely to be violent than anyone else. Over 90% of violent acts are committed by people without mental health concerns. And sadly, people with severe mental illnesses are over 10 times more likely to be victims of crime than general population. In some cultures and religions, mental illness is perceived as punishment by God for transgression in this life or previous life, and individuals with certain mental illnesses are believed to be possessed by demons. Therefore, seeking treatment may be seen as a lack of faith. In fact, research shows that mental illness is the result of the disturbance in usual brain function that lead to disturbances in feelings, thinking, and behaviors. It's not a sin. It's not caused by spirits, demons, or bad karma. They can be managed and treated with scientific evidence-based treatments and medications. Another common misconception is that having mental health concerns is a sign of weakness, character flaw, or it's caused by laziness or moral failing. Imagine how this belief can make people feel bad about themselves and feel fearful of letting others know about their mental health conditions. In fact, mental illness is not caused by a moral failing or laziness. Mental illnesses are usually biologically based disorders and may be caused by many factors, including biological factors such as genes, physical illnesses, injury, or brain chemistry imbalance. Life experience, such as trauma or a history of abuse. Family history of mental health concerns can also be a factor. It's not anyone's fault any more than heart disease or diabetes is a person's fault. Sometimes an individual with a mental illness experiences fatigue or lack of interest as a part of the disease, not as its cause. No one should have to feel ashamed of their mental health conditions any more than other medical conditions like diabetes, cancers, and heart disease. Some people may think that individuals with mental health concerns can't handle work or school, that they have nothing to contribute to the society. This stigma can lead to discrimination in various areas of one's life. In fact, you probably know someone with a mental health problem and don't even realize it because many people with mental health concerns are highly active and productive members of our communities, since 1 in every 5 people will develop a mental health concern every year. Clearly, there are millions of people with mental health concerns who are contributing to our society. Some people may actually develop mental health concerns because they have been handling severe and persistent stress themselves without seeking support from others. For some people, they may fear that once they or their loved ones develop a mental health concern, they will never recover. In fact, research shows that mental health concerns are treatable. When treated, People with mental illnesses are able to live happy, ambitious lives that are meaningful and fulfilling. Here are some examples of people who were diagnosed with mental health conditions that have lived an inspiring life. Oprah Winfrey is best known for her talk show, The Oprah Winfrey Show, which was the highest rated television program of its kind in history. She shared that she struggled with depression, but was able to overcome it. Kay Redfield Jamison is a professor of psychiatry at Johns Hopkins University. She struggled with bipolar disorder since early adulthood. She is an expert on mood disorders, published over 100 academic articles, a classic textbook on bipolar disorder, and a seminal book, An Unquiet Mind. Adam Levine. He was diagnosed with ADHD as a teenager and continued to be impacted by it in adulthood. He was able to manage his ADHD with the help of his doctor. He's not only a singer, but also a songwriter, record producer, and an actor. There are also many misconceptions about therapy that may prevent people from seeking therapy. For some people, they may have been taught that seeking therapy is disrespectful to their spiritual belief. Yet, mental illness is not a sin. Just like cancer, heart disease, and other medical conditions, you don't simply pray without seeking medical treatment. Mental health conditions also deserve professional support and treatment. Sometimes you may think about therapy, but start wondering if your concerns are serious enough for therapy. In fact, people can not only go to therapy to cope with mental health disorders, they can also use therapy to address relationship issues, stress, grief, to better understand who they are, seek personal growth, and learn to live their life to the fullest. There's no shame in wanting a better life. Waiting until the problem gets more serious only exacerbates problems and make them much harder to untangle and resolve. One of the most common reasons people avoid seeking therapy is the belief that it will mean they're weak and incapable of solving problems on their own. The reality is that not all mental health concerns can be solved on our own. Even when you utilize self-help books, apps, or videos, there are limits on how deep they can go. Without therapy, some people may find themselves stuck in old patterns. It's a strength for a person to be willing to acknowledge that they can't do it all themselves. Seeking help means that you're taking actions, which is stronger than staying passively stuck. The cost of mental health care prevent many from seeking therapy. There are a wide variety of options available to those with health insurance and those without. We like to let the UCI campus community know that if you are a registered student at UC Irvine, you have access to UCI Counseling Center, which offers free mental health services to UCI undergraduate and graduate students. Each individual's needs are different, and so our office may not be the appropriate service option. If our services do not meet your needs, we will assist students in finding the most affordable community resource possible. It's always helpful to check with your insurance company mental health benefits and see how much your copay will be for psychotherapy sessions. It might be helpful to consider therapy as an investment in your mental health and reevaluate its cost benefit. The Counseling Center is here to support. We offer time-limited individual therapy, one-session visit, initial assessment, referral, therapy groups, workshops, urgent care, and consultation. Our services are confidential, so you don't have to worry about your parents, friends, or professors knowing that you came to us for support. Also, there's no additional fee to currently registered students. For more information about our services, service offering, and resources, you can call our front office at 949-824-6457 or visit our website at counseling.uci.edu. Thank you for watching this video. Best of luck. Go Anteaters.